Hi everyone, I'm Sean Isam T. Constancio, a medical technology intern of USI at Bicol Medical Center. So today I will be discussing about diabetes mellitus or simply DM. For the introduction, we have two types of diabetes. That is the diabetes mellitus or simply DM and the diabetes insipidus or the DI. But for now, we will just be focusing on the DM part. First of all, why were they both termed as diabetes kung magkaiba naman sila? That is for one major reason, the symptoms. So we have the three P's of diabetes, polyuria, excessive urination, polyphagia or excessive hunger that leads to excessive eating. And the last one is polydipsia or excessive thirst that leads to excessive water intake, of course. Diabetes mellitus is a chronic metabolic disorder characterized by persistent hyperglycemia. So when we speak of hyperglycemia, it pertains to excessive amounts of glucose in the blood. And it may be due to these two major reasons. The first one is impaired insulin secretion, and the next one is insulin resistance. Let us define first what insulin is and what does it do. So insulin is a hormone produced by the beta cells of the pancreas. And it serves as a key para siyang susi na ginagamit ni glucose para makapasok ng cell. So, if anything na magkaroon ng problema sa insulin or insulin production, walang gagamitin si glucose para makapasok siya ng cells. So, dadami si glucose. Yung concentration ng glucose na hindi nagagamit is dadami sa blood, leading to hyperglycemia. So, that is yung impaired insulin secretion. Yung kulang yung production ng insulin. The next one is insulin resistance or the exact opposite of impaired insulin secretion. Dito naman, you could have a normal amount of insulin production, but the thing is, your cells are resistant. So, si glucose, meron siyang susi, meron siyang insulin na pwede niyang gamitin, but the thing is, yung cell resistant, hindi niya pinapansin si insulin. So, hindi pa rin makakapasok si glucose sa cell and dadami yung concentration niya sa blood, leading to hyperglycemia. So, apparently, this is what it looks like sa blood vessels natin or sa ugat natin. So, the left image represents the normal one and yung right image naman represents diabetes. So, our goal is always to maintain homeostasis or the normal stable condition ng katawan natin. Chronic hyperglycemia can cause damage to various organ systems, leading to the development of disabling and life-threatening health complications, most prominent of which are microvascular and macrovascular complications. So, when we say microvascular, the damaged or the affected blood vessels are the small ones, such as the venules, capillaries. When we say naman macrovascular, affected blood vessels naman is yung malalaki, such as the arteries and veins. Microvascular complications include retinopathy, nephropathy, neuropathy, and the likes. While sa macrovascular naman, example are the cardiovascular diseases. So this one shows retinopathy. Affected organ is yung mata, the eyes. So as you can see, there are blood clots, visible blood clots, and constricted yung blood vessels niya. This one is diabetic nephropathy. Affected organ is the kidney. So normally, as you can see, proteins do not pass through the urine. So, filter siya ng glomerulus. But for diabetics, nagli-leak yung protein as well as yung glucose. Sumasama siya sa urine. This one is peripheral neuropathy. Affected naman is yung nerves mo. The peripheral nervous system. Manifested siya as having numbness and tingling sensations, loss of balance, feeling of pins and needles na parang tinutusok-tusok, and sometimes you might feel over sensation or no sensation at all. And the cardiovascular complications. So for the literature review, just recently, there was a study conducted by Lim et al. At Seoul University entitled COVID-19 and Diabetes Mellitus from Pathophysiology to Clinical Management. So what they discovered was coronavirus infections really has a huge impact in the management of DM patients because SARS-CoV-2 aggravates inflammation and alter immune system responses, leading to difficulties in glycemic control. So mas mahirap daw i-manage yung DM patients na nakakontract ng COVID-19. And within their study, they experimented on treatments. They had two experimental agents, namely dexamethasone and hydroxychloroquine, which have shown promising results as combined than either of which alone. So, in terms of treatment, mas effective daw na in combination ng dalawa compared sa isa lang yung gagamitin. And the researchers concluded that getting vaccinated against SARS-CoV-2 is the best way to avoid complications. Since mahirap ngang i-manage, so much better na iwasan na lang na makakontract ng COVID. So for the discussion proper, let us define what hyperglycemia is. As I've said a while ago, it is an increase in blood glucose concentration with a fasting blood sugar level of at least 126 mg per dl. So the following are the lab findings in hyperglycemia. Increased glucose in plasma and urine, increased urine-specific gravity because of the solute nga, ketones, presence of ketones in serum and urine. Ketones are actually byproduct of fat metabolism. So normally, our body uses glucose as source of energy production. But on the case of DM patients, since hindi nila na-utilize si glucose, they use stored fats as source of energy production. And byproduct of fat metabolism is ketones. Decrease in blood and urine pH or acidosis, and electrolyte imbalance. So decreased sodium, increased potassium, and decreased ang bicarbonate. Hence acidosis. So this table shows the major differences between type 1 and type 2 DM. So for the pathogenesis, sa type 1 merong beta cell destruction. So ito nga yung impaired yung insulin secretion kasi destroyed yung beta cells mo sa pancreas. And ang nagkakos ng destruction nito is autoantibody. Excuse me. So autoimmune ito. While sa type 2, normal or okay yung production mo ng insulin, okay yung beta cells, pero resistant si cells. So that's the major difference. So on incidence rate, mas common si type 2, almost 90 to 95%. Sa onset naman, though any age naman siya, pero mas common si type 1 sa children or sa younger years. While si type 2 naman, mas common siya sa adult. Sa risk factors, genetic or autoimmune si type 1. Sa type 2 naman is affected siya ng lifestyle like obesity, sedentary lifestyle, and the like. So, C-peptide level. So, C-peptide is another substance na napoproduce siya kasabay ng insulin. So, bakit siya detectable sa type 2? Detectable si C-peptide kasi sa type 2 nga meron siyang napoproduce na insulin. So, normal si insulin. Sa type 2 may napoproduce siya. So, may mapoproduce din siyang C-peptide. So, detectable. Sa type 1 naman, may problema ka nga sa insulin production. So, may problema din sa production ng C-peptide. So, decreased or undetectable sa type 1. Yun nga, may autoantibodies sa type 1. Sa type 2, negative siya for autoantibodies. Symptoms, ketosis, and medication. So the third type of DM is the gestational diabetes. So this happens in pregnant women naman and disappear after delivery. But in some cases, bumabalik siya years after manganak. So screening and diagnosis of GDM is done by monitoring the patient. May pinapainom na glucose load and minomonitor after 2 hours kung gaano siya kabilis ma-metabolize ng katawan. So, GDM is diagnosed if one of the 3 criteria is met. So, if you have an FBS or fasting blood sugar of greater than or equal to 92 mg per dl, or after 1 hour kang painumin ng glucose load if you have greater than or equal to 180 mg per dl, which is the renal threshold, or you have, after 2 hours, you have a greater than or equal to 153 mg per dl. So, after giving birth, women with GDM should be evaluated 6 to 12 weeks postpartum. So, closely monitored pa rin siya. So, these are the tests done in diagnosing diabetes. So, the first one is the HbA1c or the glycated hemoglobin with a cutoff value of 6.5%. So, this test doesn't need fasting beforehand because it provides your average blood glucose level over the past 2 to 3 months. The next one is the FBS. Ito yung kailangan na ng fasting. With a cutoff value of greater than or equal to 126 mg per dl. Next one is OGTT. Ito yung sa gestational diabetes. So your blood glucose level is monitored within 2 hours after taking the glucose load. The next one is the random plasma glucose test. So hindi rin ito kailangan ng fasting kasi random din siyang ginagawa. So for the prevention, type 1 DM simply cannot be prevented kasi autoimmune disease siya. On the other hand, type 2 is preventable because affected siya ng lifestyle. So it can be prevented by maintaining a normal body weight, physical activity, and eating a healthy diet. So for the conclusion, diabetes mellitus is considered as the epidemic of the century. And without effective diagnostic methods at an early stage, diabetes will continue to rise. Moreover, our advanced knowledge of the association between medical genetics and the chronic complications of diabetes will provide an additional advantage to delay or even eradicate these complications that impose an immense pressure on patients' quality of life and the significantly rising cost of healthcare services. So talagang knowledge is indeed powerful. Kaya naman, an investment in knowledge pays the best interest. So that would be all po and thank you very much.